trigger finger is most common in the middle and index fingers. What trigger finger is an inflammation of a tendon. This is known as a nodule that is right below the tendon sheath as shown in this picture here. As the finger bends and straightens, the tendon would actually glide through the sheath here. But with that nodule, it's almost like a little bump in a pulley system that causes that uneven gliding. And then you get that flick of the tendon of the finger when it opens and closes. And you may even get a lock of the finger in that one position. Now, this commonly forms right where the base of the palm meets the start of the finger. And in the thumb, it typically happens in that inner corner. So we're going to go through some exercise right now that you can do at home to help counteract this. These first series of exercises, we're going to go over the fingers. So that is the index, middle, ring, and pinky fingers. If you want to skip to the thumb because you only have trigger thumb, you can go to 11 minutes and 36 seconds in this video. Start with shaking out your hand. We're going to do what's known as passive finger stretching. So make sure your forearm is supported and your arms are completely rested. And whatever finger or fingers you have difficulty with in regards to trigger finger, that is what you're going to passively move with your other hand. Now, when you're doing this, it's important to note that you are just going in a pain-free range of motion. You don't want to contract your hand that has a trigger finger. You want all the work to be coming from the other hand. So you're completely staying limp and moving all the ranges. We're doing about 10 reps per finger here, or however many fingers are involved. And you just rinse and repeat. Switching over to the next finger that's involved, you're going to repeat the same exact thing. Again, it is crucial that you keep that hand really limp and dead weight basically, and you're doing all the work with the other hand. Again, work within a pain-free range of motion, and you're gently working that tendon in and out of the sheath so that you're not irritating it more, right? The idea is to rehab this and to help make it feel better and to help loosen up some scar tissues and making sure the tendon itself doesn't get shortened, stiff, and restricted. At my clinic, it's also important to note that we use laser therapy to help with this, to decrease the irritation around the tendon itself and the scar tissue around the tendon sheath. So now elevate your arm a little bit so that you have room to stretch the finger. So you want to stretch the fingers that we just worked on. Stretch it back as far as you can, comfortably, again, focusing all within a pain-free range of motion. We're going to hold each stretch for about 10 seconds and switch to the other finger. Or if it's just one finger involved, then obviously give yourself a little bit of a rest for 10 seconds. Just showing you different angles here so you can make sure you are getting the most out of this video and you're understanding completely what I'm saying. Of course, if you have any questions, don't be afraid to leave that in the comments below, guys. I get back to every single one of you as best as I can. An interesting fact about stretching, they just released an article that says when we stretch, we're actually focusing on the tendon aspect. So for those who don't know the anatomy, tendons are what attach the muscle to the bone. And when we stretch passively like this, we are focusing on stretching out the tendon, which is great in this case because it is the tendon and the nodule of the tendon and the surrounding sheath just above it around the finger that is irritated. So when we passively stretch like this, it's getting at the tendon, helping to focus on what is the problem in the first place. And honestly, even if you don't have more than one finger involved, I invite you to focus on multiple fingers, especially the two middle ones, because if one tendon is involved, that will affect the other aspects of the hand, so it wouldn't hurt to go above and beyond. We're also going to be stretching other areas of the tendon as well. So you're going to now grab your fingers on the back of your hand, so the back side of your hand, and help separate the fingers just to stretch the tendon in a different range of motion. So take your fingers almost like in a pincer grip and a pinch grip and just separate the fingers. And again, we're going to focus on all different directions and areas of the hand to really focus on stretching the tendon from all angles. Of course, as usual, if you have any pain or discomfort, don't push yourself past an uncomfortable, painful range. We want to do all these exercises in that pain-free range of motion. And as you do this more and more, things will become easier and easier. We're now going to grab a pencil with an eraser on it, or even the back of a pen if it's flat, and use this as a tool to help work with transverse frictions along the tendon or where the nodule is. Sometimes people will actually see that bump on their hand, but in this case, we're going to work right where the crease of the palm meets the finger, right there. And don't be afraid to go in all different directions and start light first. So don't put too much pressure that you're essentially giving yourself a bruise as if you're trying to make a hole through your finger, right? Just start light, because it's always easier to go a little bit longer or do a little bit more if it wasn't enough for you and you notice no change versus trying to undo what you did if you pushed yourself a little too much, right? That's practically impossible. So just I'll go in different types of directions. So I go parallel to the tendon, and I go transverse to the tendon. I also go on diagonal motions all over. And again, if you have only one finger involved, we'll just focus on that finger. When I switch to the fingers, or when I switch fingers, and obviously take a break, you don't want to overdo it. Again, it's harder to undo if you did a little bit too much, but always easier to add a little bit more if you found that you can take more and there is no issues. So again, explore all different directions. We're now moving in the transverse plane as opposed to the parallel. So I'm essentially doing about 10 to 20 per direction. And switch to the other finger. So start moving along the tendon just to warm it up. And this is great to help break down scar tissue, which is one of the causing factors of that trigger finger in the first place, because as that nodule slides through that tendon sheath, that is what ends up causing scar tissue on the tendon sheath. So this just helps to loosen everything up and give it as much of a fighting chance to reverse these effects as possible. Again, cold laser that I do at my clinic, BioFlex cold laser, is a huge help for this, because it helps repair cellular damage, decrease inflammation, which is the inflammation of the tendon, which is the inflammation around the nodule, and also helps to reduce and soften the scar tissue to make it more elastic, so it takes some irritation off the tendon sheath as well. But hey, if this works for you, I'm happy. And honestly, if you pair these two together, typically you have an even speedier recovery, because this usually tends to get worse and worse. Some people even end up requiring surgery. So if you can do everything naturally, it just saves you a lot of time in terms of recovery after, because even though surgery can be quick, there's also the downfall of it maybe not working, you having secondary complications from surgery, all those types of stuff to consider for sure. So now we're working on those diagonal angles along the tendons. Make sure to do both directions. And now for the last portion, we're going to do an active soft tissue stretch or active soft tissue release, where we use the other hand to pinch down the tendon right where that nodule is and right where that palm of the hand meets the index finger or the ring finger, wherever we're working on. And you just actively move the finger in as much range of motion as you can with no pain, and just try to glide and stretch and move that area to help loosen the tendon up and the tendon sheath up. So again, like I'm actually pinching down and focusing on that area. And if I'm moving too fast for you, say this is your first time or second or third time doing this video, and you need to move at a slower pace, keep in mind I do not have trigger finger. So when I'm moving my finger and it looks effortless and maybe a little bit too smooth and it doesn't look like yours, again, keep in mind, I do not have trigger finger. So just go at a pace you feel comfortable, and you'll get better at this the more you do it. Now, in terms of the thumb, we have to remember the thumb is almost like a finger, but it's turned 45 degrees. So when we are passively moving the thumb like this to help engage the tendon, warm the tendon up, bring blood flow to the area, we have to make sure we are doing that on that 45-degree angle, and make sure your hand is limp. Okay, you want to make sure that your thumb of the affected side is completely loose and all the work is coming from the other hand. Now only go in a range of motion that you feel comfortable. And you always start with a little less, so maybe stick to 10 ranges so that you can progress as necessary. It's always easier to do a little bit more than it is to try to undo what you did. So if you notice just there, I crossed my active hand behind my affected hand, grabbed the thumb and stretched it from the outside. Again, only do this range in what you can tolerate. It should feel like a nice stretch. There should be no pain associated with this, and slowly release the thumb. And then stretch again for about another 10 seconds. Really allow it to open up nicely. And slowly release. And we'll do that one more time in this direction. And you may notice that every time you stretch, you're able to bring the thumb a little bit farther. So the interesting point about stretching is stretching helps to stretch the tendon, which, if you remember the intro, the beginning of the video, that's where the nodule and the inflammation is. So now we're going to turn the hand down so your pinky is on the table, and you just take the side of the thumb and pull it to basically form the letter L. So you're grabbing that inside part on a different angle and you are pulling downwards. So thumb stays right by the side. Grab the thumb with the index finger of the other hand and pull it down, stretching on that angle to get, again, a different area. Again, we want to stretch the tendon all different directions so that we're working it in all ranges of motion. And form that L stretch, hold for about 10 seconds. Of course, all within that pain-free range of motion. And now thumb by the side, wrap your fingers around, Hook with your index finger on the inside and gently pull down. Now I want you to grab yourself a pen or a pencil with an eraser end on it. And we're going to work on that inner corner of the thumb. Remember, the thumb is like a finger placed on a 45-degree angle. So we can't work on the front, that would be the side of the thumb. We have to work on that inner part of the thumb. Now you take the flat end of the pen or the rubber end of the eraser of the pencil, and you're gonna go along the tendon at first. And we're also going to go transverse to the tendon. We're going to work on diagonal angles. We're going to work in all sorts of different directions to help break up the scar tissue, to help warm up the tendon, to help initiate that inflammation process, to actually create that healing process, because inflammation is the first stage of healing. So this just helps to attract blood flow to the area and therefore white blood cells to help clean up the scar tissue that we are chipping away at. Let's just show you from a different angle of where we're working. Again, kind of work all around, on top of the tendon, on the sides of the tendons. And I'd recommend doing these exercises at least once a day. Depending on how bad it is, you may want to do this multiple times per day, but just pay close attention to your symptoms. If things are starting to get worse, I definitely recommend going to see your doctor. But also, it wouldn't hurt to seek out laser therapy in your area. If you don't live in Sudbury, Ontario, near my clinic, I definitely try to look up BioFlex laser therapy in your area to see if there's any clinics that you can go to help speed up this healing process. Now we're going to do an active soft tissue release. So just pinch down that base of the thumb and actively straighten and bend the thumb to help work that nodule and the tendon. We do this about 10 times. So this is first time doing it. I recommend just sticking to the reps that I do here. And as you get better and more comfortable with it, then you can add on reps as you see fit. Now, bonus material. I'm going to show you how to tape the index finger and the thumb just to help alleviate the range of motion of these joints so that the tendon and the nodule of that tendon doesn't flip through that tendon sheath. So as you saw me measure there, I took a piece of tape and I measured it from the tip of my thumb to the base of my thumb. And now I'm just folding in half to cut off the edges. The point of this is to get rid of those corners so that the tape isn't pulled and is rolled up. Essentially, you just rip off a corner, peel it back, and then you tape along the back side of the thumb first, right kind of at that base of the thumb, and you gently wrap around. I don't pull very hard, I more or less just pull it around, and I almost hook to form a ribbon type of shape. And I try to get that V of where the tape would be is right in the middle of that distal joint there. So now, as you can see, it's limiting my range and flexion so that the tendon wouldn't glide down and go through that tendon sheath. Again, this isn't 100% for immobilization. It's just to help decrease a little bit of the irritation so the tendon doesn't have the tendency to have full range, just to help with initial stages and to help keep inflammation down. And same thing, I'm using that other piece of tape to show what you would do for the index or middle finger or ring finger or pinky finger. Again, I'm using the tape to cut off the corners so that the tape can't roll up the same. Ripping off one of the corners. And in this case, I'm going to tape the middle joint. So again, starting on the back and just wrapping it around as best I can. Again, trying to get that middle V shape or V pattern. I'm going to have to adjust it a little bit there for you. So you're going to see me go back and adjust it because I ideally want that V here to actually be right there in the middle. So I just adjust the positioning and the angle just so that more of the tension and the limitation is put properly on that joint. So you may have to play around with the angle a little bit, as you can see me doing here, so that you can get that V shape right in the back of the finger in the middle. Same thing with this one. Again, I'll kind of just play it around to show you a little bit better. That V should be right in the middle of the thumb in line with the middle of the nail. And what I did here, because I did have a little bit of it left, I just pinched it off, and if it bothers you, you can just cut it off like so, or you can just leave it. Again, this isn't something that you would leave on all the time because we do want to keep that motion so the tendon doesn't completely stiffen up, but we're just using it for when we have to use our fingers a little bit more, say we're typing or we're doing a big report or something like that, just to kind of help that nodule from flicking within the tendon sheath over and over again. So that is it. That is the quick and dirty tape job that you can do with KT tape or any type of sports tape that is elastic that you can find your local pharmacy or Amazon. Again, I'm not selling that, or that's not a promotion. That's just simply where you can get it if you like. So that's what it should look like. I want to thank you guys for sticking through to the end of this video. Please subscribe if you haven't already. That way, and hit that notification bell, because that way you will get notified of every single video that I release in the future. And of course, if you have any suggestions, questions that you want to ask me, leave that in the comments below, and who knows, maybe I'll release one of your requested videos in the future. Thanks for all your support.